Hey everyone. First I just want to thank everyone because on my last video you guys didn't have to watch it and people were very sweet about commenting and just are very sweet about what's going on. Just it makes it a lot easier to have people on your side and to have people that aren't making you feel worse. But that aside, you clicked on the video because it's a surgery. And I wanted to make this video to describe what is happening because I don't want to have the patience to sit here and type it all out. It's just easier for me to make a video, and in that way, if somebody else is having the same surgery or is going through the same kind of thing, they can watch it and see they're not alone. So I'm with Dr. Henderson last year. I want to say July was my first visit with him, and we first talked about my cervical spine or cervical instability problems. Then I was 90% sure I was going to be having neck surgery, and they're going to fuse my C1 to my C2 and all that jazz that a lot of people that go to Henderson get done. But on my last visit, or my 2 visits ago, he sent me for a whole lot of lumbar, thoracic spine, MRIs, x-rays, a lot of that jazz. I left one of the MRIs crying because it hurt so bad because I had to lean backwards. And then I went and I saw him, and he told me I had tether cord, which there's usually, he says that there are 4 things that he diagnoses you on, and I had all 4 of those things. So he's like, you're a candidate for surgery, and I was like, okay. And he put me on the emergency list because of how much pain I've been in and how bad it's been, and since and it's been getting worse. First let's describe like the pain and stuff. I have severe pain in my back. Like sitting on the floor right now, I'm going to regret this later. I'm already starting to regret it now. But the only place I really had to film. And it's a lot of pain in my lower back, but it comes up my back, into my shoulders, into my neck. And I'm not saying all this to look for sympathy. I'm just saying my symptoms so other people who have the same thing know that they're not alone. I have shooting pains down my legs. I actually have a lot of stroke-like symptoms where I lose complete feeling in my left arm, my left leg, or one over the other, to the point where I can't move them. And that's really scary because I'm 20 years old. I'm supposed to be able to move around the house by myself and not have my mom have to help me get places. It's scary. The left side of my face droops. You might have noticed it before if you're talking to me. You might notice it now. I don't know if it's doing it. The right side of my face moves more than my left side of my face normally. But there are times that my left side of my face will just droop. I don't know why. I have these really weird shaking episodes. They're like twitches, but then they can turn into full-on shakes. So I was twitch, I'll just be like that, and I can't stop. But then they'll turn into these shakes that look like I'm having a seizure. But I'm all there. I know what's happening. I'm crying because it hurts because it's dislocating my joints. I have a lot of nerve pain, a lot of headaches, just a lot of that fun jazz. I can't really think of anything else right now because I have brain fog. But one of the things he's going in to fix is because he believes that my back is a tether cord. What's going on is in my back, it's pulling my back taut. So it's pulling everything in my back really tight. So that's where all my back pain's coming from, where all my neck pain might be coming from, is that everything is being pulled straight and tight and just not happy. My back's not happy. I don't really understand what he's going to do, but all I know is he's going to go in, take something out, and I don't know if he's putting it back in after he cleans it or putting something else in. I don't really understand the whole surgery. I'll get a better idea on the surgery day. I'm in surgery January 7th, and I know I should probably have a better understanding before I go in. My mom has the whole understanding of what's going on and all, but there's been so much going on that I'm kind of just like, I just want the surgery. I really don't care what they're doing to me. Like, if it has any chance of helping, do it. I will be going to Maryland. Yes. So January 7th is a Tuesday. I'll be traveling down on Monday, I believe. And then getting the surgery on Tuesday. I should be out of the hospital by Friday. And then going to a hotel. Staying in a hotel until I see Dr. Henderson on Tuesday, next Tuesday, and then driving home. So I'll be a week away from home, which really isn't that bad. Like, I thought it'd be worse, but I have to lay straight. Like, I can't move for, I think, a day or two, which is going to be hard, especially if I start twitching, which just happens a lot. I have a hard time laying still. But yeah, just want to tell everyone I'm having surgery. Everything will be fine. Dr. Henderson is quite an amazing guy. If I had to trust anyone to do this, it's definitely him. I don't think I could trust anyone else, to be honest. They call him the wizard for a reason. Yeah, if you guys have any questions, just ask. I'm not afraid to answer anything. So yeah, having surgery finally. Hopefully it would help. Talk to you guys later. Bye.